Philosophers of aesthetics have argued for centuries that art can break us from our habits. Art can create a new vision of reality, instill a sense of gratitude, provoke critical thinking.
Welcome the new people. I am Nancy and I'm going to be one of your guides today.
Trying to create socially based interventions for individuals with chronic pain. Museums and other art spaces have been used to support a number of other people with a number of other conditions, mental health issues, dementia and Alzheimer's.
Art as healing. That's what UC Davis is exploring with a pilot program called Art RX. The goal? Discovering whether specialized experiences through art could reduce the burden of chronic pain.
For many years, people have understood chronic pain to be a really complex biopsychosocial phenomenon. We know that the social context in which the individual is experiencing these unpleasant sensations has a real impact on health outcomes. But we've done an inadequate job in terms of operationalizing that, in terms of creating programs and interventions. I mean, if you will, just take a minute and imagine what it feels like when you walk into a health clinic versus when you open the doors to a museum. Now, this isn't to say that a health clinic is going to be able to replicate all of the architectural elements of a museum.
Through programs like Art RX, UC Davis is starting to measure the impacts on our health when art is incorporated into the healthcare environment.
How can we partner with organizations such as museums and art galleries, but other community resources to be public health partners?
Her question is, where does it begin and where does it end?
It's really important to understand that all of the work we're doing is about integrative health approaches, not alternative health approaches. No one involved in this project is suggesting that one should go to a museum instead of going to their healthcare provider. Far from it. What we're suggesting is that it's possible that doing things that elicit a sense of social connection and joy may complement the work you're doing with your healthcare providers.
This digital short is supported by UC Davis Health, home to the #1 ranked medical center in Sacramento by U.S. News and World Report. Learn more about their doctors and their passion for advancing health at health.ucdavis.edu.